Oh, hello, everybody. Just gonna let everybody in. And we will get started in a minute.
When did it put you? 10/16/1957.
Hello, hello.
Welcome, everybody.
Welcome. All right. I got 1 o'clock. We're gonna get started. We are recording this meeting, so if you get called away, we've got it for you. I'm Kim Sterling, and I'm Vice President of Professional Services here at NCCHC. And my partner in crime for most of the presentation is Rich Forbes, Vice President of Business Program Development. And we have a guest appearance by Matisa Salmons, our Vice President of Certification, who will talk a little bit about the CCHP program. So thank you for taking the time to be with us today. And Rich, if you'll keep an eye on the waiting room, I will jump into this thing and we'll get you going.
I'm on it.
Great. And if you want to use the chat, please feel free. We'll be monitoring the chat as well. So, all right. I think we're actually on the right screen and everything. Okay. So thanks. Our agenda for today will be to talk about getting to Las Vegas, getting to the conference, what you can expect at the conference. And that's kind of part one. In part two, we'll give you a little bit of background on NCCHC, the services that we offer, how we can help you and your facility and your patients. And there's always Q&A available. Please feel free to use the chat or stick around afterwards. We find at the end people want to, ask one-on-one questions, and that's totally great too. So again, thanks for taking time out of your day. We are recording the presentation and we are going to send out a link to the presentation and the slides. So that will all be available to you starting tomorrow morning. So here we go. Here's some fun photos from our last couple conferences. And we want to help you get the most out of your experience. If you're a first timer or you haven't been to too many in-person conferences, just how to get around, how to find things. And most important question is how to get your CE credit afterwards. So let's go. I'm going to suggest the first thing that you do is check the agenda online. It is as up to date as possible. We do have last minute speaker changes and cancellations, so sessions may change. So keep an eye on that. The best thing to do in advance, because it is a very large conference with between 6 and 8 concurrent sessions going on at the same time, is to figure out exactly what you'd like to attend. And do when you're packing, pack a pen and paper so you have it to take notes on. The conference takes place Monday, Tuesday, Wednesday. So if you only registered for the conference, you don't need to show up until Sunday evening or Monday morning. If you're registered for a pre-conference seminar, those take place Saturday and Sunday, and we'll go through that calendar in a little bit more detail in a minute. One thing that's really great to do before you leave is to download the presentations. You can go into your my.ncchc.org account, and on the left, there's a header that says My Conference Proceedings, and every conference that you've been at will be listed there. And for 6 months after the conference, you'll be able to download the presentations. So that's something nice if you're a note taker who likes to have materials on paper. You can go ahead and bring those along with you or download them to a computer if you're a laptop person. But they have been being loaded and will continue to be loaded right up to the time that we leave for conference. So you can check that right after today's presentation. And if you're still missing presentations, give it a check on Wednesday and Thursday and Friday as well. But as soon as we get them, we are trying to get them loaded up in there. The next thing I wanted to remind everybody about is that we do have a conference app, and it's called Attending Mobile, and it's in the App Store. You can use this QR code to download the app. And if you already have Attending Mobile, you can actually still scan the QR code and open it, and you'll open it into the national conference. If you've attended events in the past, you'll have older events in there. And in order to change the meeting, you just go into Change App in the top left, what we call a hamburger menu, and you'll be able to pick the NCCHC National Conference. So I can keep that up there for another minute if you want to scan that on your phones and make sure you have that. The nicest things that are in there would be an up-to-date schedule of all the events taking place, the biographies for all of the speakers, links to the map, and there's full information on all of our exhibitors. There's actually a thing that's only available on the app called the Product Finder, and that allows you to find by category which exhibitors are offering particular products and services. I don't see the chat, but do we have any questions on that? Sometimes people have questions on the app.
There's nothing right now, Kim.
Awesome. Okie dokie. And next slide is a poll. And I have lost my Zoom taskbar. So are you able to launch the poll, Rich?
Let me see real quick here. Is that under the host tools?
Yeah, right at the bottom. Oh, sorry.
Yeah, I'm not seeing it here.
I found it.
Okay.
Alrighty. If this is your first time in Las Vegas, did the poll come up?
Yep, it's up
Yes,
now.
people are answering. All right. Rich is actually from Las Vegas, so he will be interested to hear your Vegas experience.
A lot of no's. I'm surprised. That's good.
Yeah. So we've got a lot of Vegas regulars,
Very cool.
and I don't know if everybody can see the responses or not. It's hard to tell what people can see from here. So we've got our no's at 80%. Only 20% are Vegas first timers, and nobody said that they don't remember the last time that they were there. So that's very good for this crowd. All righty. We will move on back to the slideshow. There we go.
May I ask one question about the app?
Yeah, absolutely.
I'm not seeing any way to message attendees, correct? Some apps have that. This one does not.
No, you can do a post and put a general announcement in there, but it doesn't have person-to-person messaging.
Okay, thank you.
Thanks for asking. All right, we're still trying to move our slides ahead. There we go. Great. All right. So if you have been there before, then you know how close the airport is to the Strip, and getting to the hotel is pretty darn easy. Just to give you a feel for expenses, I know some people are on really tight budgets. There is an hourly bus, and that'll only cost you $2, and it'll drop you at Flamingo and Las Vegas Boulevard, which still gives you a 10-minute walk, which can be good if you don't have too much luggage to bring with you. There's the website for the bus is on there. Most people, I think, will end up taking a cab or an Uber or Lyft, somewhere between $20 and $25. Just watch out for surge pricing. Takes you less than 15 minutes depending on traffic. So that's generally the best way to go. If you're local or driving from like California or Arizona somewhere, the parking is $20 or $25 a day, depending on if you're staying at the hotel. And if you're a Vegas resident or a Nevada resident with a driver's license, the first 3 hours are free. You can also look, of course, for less expensive parking, but that's the parking at the hotel. So suggest looking at some parking apps if you are need to have a car there and you want to save some money. Since most of you have been there before, you guys are all pretty familiar with the excitement of the strip, and where we are is kind of right towards one side, but still pretty much in the middle. We're on the Blue Star there. You've got 4 miles of restaurants, shopping, and attractions just on the strip. That doesn't even count anything else in the city. You can look on Open Table, Yelp, or Vegas.com to find restaurants, basically on, every budget point. There's food courts close by in the Cosmopolitan Hotel and in the Horseshoe if you're, really watching what you're spending. Vegas is really wonderful for us for our meeting in terms of the room rates, but we know that food can be pricey for people, as it is basically everywhere. One fun thing you can do is take the monorail from one end to the other, and that's only $5.50. So that will allow you to see the whole strip and see all kinds of cool stuff. So strong suggestion, especially if you've been there before, to make sure you take a good look. One thing that's new this year is discounts on dining and attractions. This is a new program that the Las Vegas Convention and Visitors Bureau has rolled out, and it allows you to get discounts. There's some for restaurants. There's like 20% off at the Hard Rock. There's a couple free drinks if you go into certain places. A lot of it is a percentage off on shows and attractions. So especially if you're bringing a guest with you, can be fun to check out. I signed up for it a week ago and I'm not getting spammed or anything. So I can tell you that it's pretty safe to do. And you sign up at this link, lvmonorail.com/LVCVA, and it'll give you a specific list of discounts. So just something there to help you save a little bit more money. And that information, actually, I should mention, is also on the event website under the hotel page. All right, so we've gotten you to Vegas. If you are staying at the hotel, you'll be checking into the hotel. I do want to warn you that there's a $37 resort fee. It's optional, so you can tell them to take it off your bill, but that does give you your in-room internet and guest passes to the fitness center. So think about that. We do have internet in the meeting itself, but of course, you're not gonna be able to get enough bandwidth to like watch a movie or something. But should be good for checking email and keeping up with your office. If you're wondering where to go, we do have all of the conference space at the Paris Hotel. So when you walk into the lobby, past the casino, past the Martha Stewart restaurant, and look for the conference center. If you get to the Horseshoe, you've missed us, but it's awfully hard to miss us. And if you're registered in advance, you're going to go straight through the conference center into the lobby, and there'll be a badge print, huge badge print station there. I'm going to show you a map next. Once you arrive there, you'll get your bag with goodies in it, including this final program, which is a 80-page print book that you can start marking up and take around with you. And do use it to find where your rooms and your sessions are. So here's a quick map for people who haven't been to the Paris before. On this right side map, there's an area that's marked registration desk. That'll be for people who are not yet registered for the event. So probably not anybody on this call. You want to walk all the way down to where that blue arrow is, and there'll be a big badge pickup station. If you decide that you want to sign up for a pre-conference seminar on Saturday or Sunday, you will go to the registration desk and you will fill out the form and sign up there. As you can tell on the left side, that's a map of the full Paris lobby. And at the top is the big round driveway where you walk in, and you're going to kind of come straight down this fake cobblestone street here. Past the, what's it called? The Crepe Place, and turn right into the Paris Lobby Conference Center. So you can't really miss us. Remember, most people are coming to the conference by themselves. They don't know anybody either. So feel free to, break the ice, sit down with somebody who's sitting by themselves, introduce yourself. Really, you know, if you're just going to watch the presentations, you know, that's great, but really meeting people and building your network is the most, you know, one of the most valuable benefits of attending the conference in person. So please do feel free to, you know, start meeting people and introduce yourself and kind of jump on out there. Next slide we have are the daily highlights. If the slide will go forward, yes, there we go. So as I said earlier, Saturday will be the pre-conference seminars, and that is an extra registration fee. Starting tomorrow morning, everybody who's registered is going to get a confirmation. We call it the Know Before You Go email, and that will have listed on it what you're exactly registered for. So it will show any pre-conference seminars on Saturday and Sunday, and then also the conference on Monday, Tuesday, Wednesday, if that's what you're registered for. So if you have any questions on that, you can contact us in the office before our office staff starts to leave for the conference, or just bring that letter with you when you come to registration. There's coffee in the morning for people attending those pre-cons, and then we've got the NCCHC bookstore open from 10 to 2 if you need to pick up a copy of an NCCHC standard or some NCCHC spiritware. On Sunday, more pre-conference seminars in the morning and the afternoon. Again, we'll have coffee, and that is the afternoon of the CCHP and specialty exams. So if you have applied in advance and registered in advance, we invite you to definitely come and take that exam. There is a study lounge in the morning that is open for you that will have, I believe, some refreshments in it, and Matisa can correct me. And that is sponsored by Yes Care in honor of the CCHPA 30th anniversary that we'll be celebrating during the event. So we've got some fun celebration activities taking place. The real stuff.
I have a quick question.
Yeah.
The test, is that only given on Sunday, or can we take it like Monday or Tuesday or Wednesday?
No, for most people, the test is only on Sunday. For the CCHP RN, will take place on Monday. So definitely hang out on the chat if you've got more questions on that, or you can contact us afterwards at cchp@ncchc.org.
Got it. Thank you.
Thanks for asking. The fun ramps up with the beginning exhibit hall opening reception, snacks and refreshments starting at 5, and a great chance to start meeting people, visiting the exhibits, getting all the free stuff that they're giving away, meeting the exhibitors, and you'll have like a real party atmosphere going on there. And then at 6:30, this will be a new event for us. We'll be having the NCCHC Foundation reception, where you'll be able to hear from a number of our scholarship winners, as well as some adult beverages, more snacks and refreshments. We're going to have a raffle. We'll be giving away some cool prizes, including a couple helicopter rides over Las Vegas, and there'll be a live auction of some cool hotel packages. And all that money goes to support our foundation, which you'll be hearing a little bit more about it later.
May I ask a question about the raffle?
Yeah.
This will just be my second NCCHC, and I'm an exhibitor. The raffle that we participated in was on the last day at Spring. Is this the same one we're talking about?
No, we just to
Different.
make extra exciting, we've got 2 raffles.
Thank you.
So there's a raffle that takes place in the exhibit hall, and everybody will get a free ticket for that. And those tickets will be preloaded into the drum, actually. And that is for attendees only. And the exhibitors have donated a number of prizes. And that raffle will take place at 11:30 on Tuesday morning, right before the exhibit hall closes. This is a cash raffle on Sunday evening for people who are attending the reception. And I think it's like a $5 ticket. $10 you get a free Vegas tumbler. And I actually not sure what the prizes are, but I know at least one of them is the helicopter ride. And so there'll be more information about that on site Sunday evening. Daily highlights, Monday, Tuesday, Wednesday. That's our main conference. We start with a keynote session and awards ceremony at 8 a.m. on Monday morning. And that takes place in the Rivoli, the Vendome room. And from there, we'll go to sessions, and then there will be an exhibit hall lunch as well. The NCCHC store is open again if you need to pick up a sweater or some NCCHC materials. And that's when the CCHP RN exam takes place again at 1 o'clock. We will be serving refreshments for breakfast and lunch in the exhibit hall on Monday. So there is no coffee before the keynote at 8. So if you need to tank up and be very cranky, you might want to grab some coffee on your way in. The Monday closes out with people who are CCHPA and CCHPMH being invited to an anniversary reception. Oh, I just also actually wanted to go back to Sunday evening in the exhibit hall. Do stop by the CCHP booth because we've got some cake and a little bit of champagne to celebrate that anniversary as well. So that will be in the exhibit hall Sunday evening. Tuesday, there's a continental breakfast, and we have we should call it a sunrise session at 7 a.m. We've got a plenary session on workforce development and the future of our field. And then we've got our concurrent sessions taking place again. There's a product theater lunch sponsored by Indivier on Tuesday at lunchtime. And then again, there's concurrent sessions in the afternoon. Wednesday, third full day of the conference, and we start with roundtables on Wednesday morning at 7:30 with a nice hearty breakfast. You'll have your concurrent sessions. We've got a lunch sponsored by Gilead, and then more sessions, and we adjourn at 4:15. So the graphic on the right will show you in your final program, there is a grid, which we call the schedule at a glance. And that's got every session taking place at all the times and all the places. And so you know what room you're going to. If you're looking at, the sessions and you want to know more about what's taking place in each one, in the back of the book, there is a full index of the conference sessions, and that will show you the educational objectives, the brief abstract, and then the names of the speakers again. So that should help you pick the sessions that should be of most use to you. And if you're scheduled for the conference, you can go to any session you like, Monday, Tuesday, Wednesday. If you start somewhere and it's not really meeting your needs, you can get up and you can switch sessions. There's a few sessions that we have that are, we call lightning sessions, where we're going to have half-hour slots. And you do have the opportunity, again, to switch rooms between these half-hour slots. It's going to be the first time we've done this in a major way, so there's going to be a lot of stuff taking place. So do check that grid and make sure you're comfortable with where you want to be when. And we hope you get a lot out of that educational content. So after the conference, the big question everybody has is how to claim your CE. So it's in your program book, and you will send you an email, and here it is here. You go back into your my.ncchc.org account, and you'll click on Claim My CE Credit. And once you click there, it'll show you any program that you've been registered for, and you go to the link, you complete it. If you want to do it on an ongoing basis, that's great. Just don't hit the final submit until you're actually done, because that locks your account. Once you're through and you feel that you are actually complete, you can submit it, and then you can print and email your own certificate to yourself, so you'll have that for your records. Any questions on that? Awesome. That is the pretty brief introduction to the conference. Are there any questions?
Yeah, we just had one. I don't 100% have this, but I think I got it right. Amy was asking about a dress code for the reception. My understanding, there's not a formal dress code for that, correct?
No. Everything at the conference is business casual. No suits and ties, no skirts required. come as you are. And no, I'm with stupid t-shirts if you're standing next to me.
That's a good guidance right there, I think.
Always good guidance. So please feel free to continue using the chat, and I'm going to turn it over to Rich now. If you've gotten what you need to do and you're completely comfortable with NCCHC information, that's cool. And if you want to stick around, we invite you, we hope you will. And Rich will take you through a little bit more about what NCCHC can do for you. And Rich, just let me know when you want me to move the slides ahead.
Okay, sounds good. Thanks, Kim. Hi, everybody. So I'm Rich Forbes, Vice President of Program Development with NCCHC. I'm going to cover a little bit about our organization today and some of the services we provide in more detail. Some of you may not be familiar with that, especially the history. So we'll be pretty brief on this, and then we'll have some questions at the end and have some time. So basically, going into our origins as an organization, NCCHC is a not-for-profit. We started in 1983, but the concept of accreditation and standards actually started in the early 70s with the American Medical Association and the American Bar Association. A lot of people don't know that. That was several years even before Estelle v. Gamble was passed as case law by the SCOTUS and became basically a constitutional basis for correctional health care. And that was in 1976, as most of you probably know. So the whole concept of accreditation standards and improving the delivery of health services inside of jails and prisons started well before the constitutional requirement started in 76. By 76, they were actually already doing pilot facilities, the AMA was, under the program. So that's kind of where we come from with the humble beginnings. We've continued that process, and now we're up to 32 different organizations that actually support us. The American Medical Association, of course, still involved with us. Basically, the standards are established that they support the rights, constitutional health care. They provide that framework, ensuring that we're having policies, procedures, operations that are not only in line with national best practices, but also those constitutional requirements, meaning the right to access care, the right to care that's ordered, and the right to professional medical judgment in the original Supreme Court case, and then the hundreds of cases subsequently that have followed. We can go to the next one, Kim.
Sure thing.
So basically, these are our programs that we have. As you're probably familiar with accreditation, most people know us for that. We do also offer consulting. Our education is huge. You're going to be participating in that, of course, going to the conference. And our foundation, we'll talk about a little bit. Kim had talked about that a little bit as well during her presentation. And the professional certification is a very big part. Many of you are CCHPs, and I hope some of you are actually taking your exam at this upcoming conference. If you are, good luck with that. It's really awesome seeing everybody turn out and do that, especially at the conference level. But on the side here, I'm not going to read through these, but you look at the common need in correctional healthcare, and you're going to look at what we do as an organization that solves that or provides a resolution to that, or at least assists with that need. The biggest one, the basis of everything we do as an organization, is our standards. That's on the very top. And as you are probably familiar with, we have our standards in health services for jails, prisons, juvenile facilities, our opiate treatment programs in conjunction with SAMHSA, and then our mental health programs as well. We can go to the next slide, Kim. All right. So standards, when it comes to our healthcare, and it comes to that basis, that foundation, whatever you want to call it, of developing your policies, your procedures, your practices, your collaboration with custody and medical, the standards are it. The standards set that foundation, they set that framework, and they basically provide that guidance moving forward and how we do everything. As I mentioned, I already covered those programs, but one thing I do want to cover that may not always be considered is how the courts see the standards, and especially at the federal level. Our standards are widely accepted by the courts. They're quoted often in findings and summary judgments when cases are thrown out. When you have a facility that's accredited and they're going off of these standards, it's a little bit easier to defend. I'm a former jail commander. I come from the custody side here in Vegas. I retired from the department here. I can tell you 100% that being accredited and being an accredited facility assisted us quite a bit in defending ourselves. And our medical vendor, our partner there, provide those services. Next slide. Thank you. All right, so facility accreditation. Basically, facility accreditation is your objective third-party assessment of your operation. We do an initial if you're new to it, and then every 3 years we're back out on site with a survey team. In between, annually, there are annual reporting requirements that come up. And basically, you're attesting to and certifying that you are abiding by accreditation, by those standards, and operating. Our on-site teams, I am a surveyor. I go out as maybe you know, maybe I've been to your facility, maybe I haven't. We go out there, we do our checks, and we're going to go in and report and let you guys know what we find. And that goes to our committee, and they make those decisions on the accreditation findings, if there's any follow-up required, etc. Accreditation, some of the benefits you get out of that. The big one, I would say, of course, aside of your legal and your liability protection is your reduction in grievances. Grievances, as you know, they go through that process, and that's where your lawsuits come from. By exhausting administrative remedies is what the technical terminology is. You'll have your people that are in custody that will exhaust them through the grievance process, starting with the lowest level all the way through jail commander and your health services administrators and your other administrators. And that's what moves you into lawsuit territory when you have that federal lawsuit come down alleging there might be inadequate care or issues. So just the reduction of grievances and those processes alone are a huge benefit. The risk of unfavorable legal judgments is a big part of that costly liability. We see some of the things that happen in the media sometimes, and we see what happens in jails and prisons across the country. We might say, how does that happen? Well, there's not it is a voluntary program. It is a voluntary process to go through and be accredited with us or to abide by our standards. It's not a mandatory type of thing. And a lot of times you do see those gaps because you don't have that good framework and foundation of processes. The public perception is a big one I can speak from. And we know now, especially since 2020, since COVID, there's been a lot of public perception stuff that drives into correctional healthcare. And I think we can all agree with that. A lot more accountability, a lot more people curious about what goes on behind the walls. That public perception showing that you're nationally accredited and you're abiding by standards that meet that constitutional level of care. Show that commitment to your safety of your patients and your persons in custody, as well as your staff and the facility itself. Next one, Kim, please. Thanks. All right, so we do 5 different accreditations. I've already covered that. I'll go ahead and skip that one, Kim. We'll go to the next one. The Pinnacle Award, and when you're at the conference, we are going to be doing presentations. We have our large presentation where we are handing out awards and doing things like that. There are going to be some Pinnacle Awards awarded at this conference for a couple of facilities. What the Pinnacle Award is when your facility is accredited in all 3 of the disciplines, your health services, your mental health services, then your opioid treatment program, if you happen to have one. Opioid treatment program also covers MAT. If you're not doing the methadone, we do MAT as well. And the new standards, when they do come out eventually here, we'll have a differentiation just a little bit on the MAT and OTP. All right, so more information about accreditation. We will obviously have a booth there, and our team will be on site to be able to answer questions for you. We'll have some of our surveyors as well at the booth, if you're not familiar with them, to go by and have that discussion. And they'll be able to give you some resources and some answer questions for you on site. So what I'm going to do now, I'm going to turn over our professional certification. Matisa Sammons is actually here on the call with us. She is our VP who oversees the professional accreditation. She's going to go ahead and cover this in the next couple slides. Thanks.
Before we do that, I do want to highlight on the accreditation slide that we are always looking for surveyors. So if you have any interest, if you have your CCHP or you've been in the field for a few years and you're interested in finding out more about that, we do encourage you to stop by the booth and find out about becoming a surveyor.
Thanks, Kim.
Sure.
Hey, everyone. Again, my name is Matisa Sammons, and just wanted to chat briefly with you about CCHP, our certification program. We've been around for years. And in fact, at this conference, as mentioned, we are celebrating the 30th anniversary of our advanced CCHP program and the 10th anniversary of our CCHP MH specialty. But CCHP is pretty much where everyone gets started. So like I said, NCCHC pioneered corrections-oriented certification in 1990. We have the largest certification program in correctional healthcare, about 4,300 certified, last I checked just a few days ago, and it shows the mastery of our standards and the knowledge expected of leaders in the field. In addition to CCHP, as mentioned, we have some other specialties. We have CP for clinical providers, which is inclusive of physicians, NPs, and PAs. MH for qualified mental health professionals as defined in the mental health standards. RN for registered nurses, and CCHPA for seasoned professionals and those on the way. And those are all the certifications I just talked about, but they've been around for quite a while. So during the conference, please stop by and see me. I'll be at the booth during most of the exhibit hall breaks. And I also have a session Tuesday morning at 8:15 that goes into CCHP certification, as well as the specialties and advanced And if anyone has any questions for me on the spot right now, please go ahead, fire away, or leave a message in the chat. I am happy to answer.
Awesome. All right. Thanks, Batista. Appreciate it. All right. So we'll go ahead and it looks like we'll go ahead and move forward. I don't hear anybody speaking up yet. We'll watch the chat there and Batista will respond. So we're going to go into education and meetings here. And this is something you'll be participating in by going to our conferences. The conferences, as Kim did her awesome introduction there, talking about what we do there, the networking. It's probably one of the biggest gains you're going to get. You're going to get a ton of educational opportunities in our different programs. As you see from the schedule, there's a very wide array of healthcare related educational presentations that are going on that are going to be really good for getting your CEUs and just getting general education. But the networking is probably the best part because you're on site there and able to talk to like-minded professionals from around the country. I think one of the biggest things, and I think everybody will agree with this, especially Kim, because we talk about it all the time, is it's very easy to be in a silo and you think you're the only one dealing with an issue. But when you get out to these conferences, if it's the first time you're coming out and you have those discussions, you're going to see a lot of those challenges that you think are yours or, it's kind of daunting and you have issues with it. You're going to see it's something that's common across the country. And you're going to hear about it in the exhibit hall as well. When you see the vendors that are out there, they're hearing the same thing. Me being a vendor, my primary role going out and doing business development, I go to these conferences that aren't ours, and I'm exhibiting at those, and we have the same discussions. And you see these common challenges across the board. And I think that's the biggest takeaway from this with the networking, is that you're going to be able to talk and kind of see what other people have done to kind of overcome those challenges, or at least have somebody to commiserate with and have those discussions, right? Is that we can sit there and share those experiences and move forward through that. We also do additional education. So the conferences, we do 3 a year in person. We also do virtual conferences and then a bunch of webinars if you haven't been to our website. And we'll have a link here at the end to give to you that has that information. But we do a bunch of different things that cover different high importance topics, relevant topics that are in the news or current trends, standards training. We cover segregation and those related issues. Suicide prevention is a big one. Substance use disorders, opiate use disorder, especially with the opiate crisis and everything going on in the country. But a wide range of things, STIs, chronic care. There's a bunch of different things that are relevant. And you also get your continuing education by attending those. Our website has a lot of archived selections as well. If you did miss the original one, you're still able to go in and get that training. We'll also talk a little bit about NCCHC resources, but we do in-person training outside of the education and meetings component of our organization. I'll cover that in a little bit here. It's more of a consulting type of approach. So our next slide here, we're going to talk about who our attendees are. And these are breakdowns based on past conferences, kind of showing you the demographics of the folks that attend our conferences. Very small percentage of custody. I come from that side and I would go to the conferences as well. But, you kind of see that vast array and that wide swath of folks that come out. And it's really good for that networking we talk about. You get different perspectives when you're in these classes. If you're one of the ones that doesn't like speaking up, asking questions in class, I can almost guarantee you other people have the same question. When you get into some of these courses, you'll see 90 or 100 people attending. So, don't be afraid to speak up. I mean, there's no question that's silly or off the wall because we've all dealt with this. We've all had questions. And I think you'll find it's a very supportive group that's in there because we all have that like-minded approach to providing that quality care. So anyway, a little bit of a breakdown for you. So I think we have a poll here next, right, Kim? We doing the job? All right.
Yes, a lot of buttons here.
We're going to kind of do a measurement of everybody here today that's still around. Looks like we still have about 60, which is great. We'll find out what everybody's role is. Always cool seeing this, seeing the different variety. Pretty good amount of administrators this time. That's interesting.
Yeah, or they're just very fast with the keyboard.
Yeah, they might be they're the quickest ones. We're multitaskers in that administrative
Exactly. Quick to respond. Great.
Okay.
So yeah, and I think you will find somebody to talk to who does something just like what you do, as Rich said. So you can see a really nice variety. And we've got all kinds of people on the call today. So
yeah, that's excellent. All right. So that's it for now on education and meetings. We will have our people here. And I know I think Mary was still on the call, but I think she's away from her keyboard. But
I'm here.
Hey, Mary, how are you? I saw you were muted and I didn't see you on the screen. So
Well, I don't want to make any odd expressions and turn anybody off.
I do that all the time, so maybe I should.
So we welcome you. We have over 111 exhibitors that are anxious to meet with you. If you have any questions for me regarding exhibiting for your company, please see me at exhibitor registration. If you are an exhibitor, you will pick up your badges when we print them on site at Exhibitor Reg. Safe travels, everyone.
Cool. Thanks, Mary. Appreciate it. I wanted to make sure I wasn't sure if you'd be here or not, so thanks for chiming in. All right, so we'll move on now. We're going to cover the foundation, and I know Kim had talked a little bit about the foundation in the context of our raffles, but what does the foundation do? A lot of folks aren't really familiar with our foundation. So basically, we're looking at that world where there's equitable access to healthcare practices. Now, look, constitutional right to healthcare in jails and prisons, right? That's there. But what about when folks get out? What about the continuity of care when somebody leaves? And we all know, whether you've been on the custody side or medical side, working in a facility, jail or prison or juvenile, we work really hard to get folks stable, to get them the care they deserve and they're entitled to. But what about continuity of care? What happens when they get out? And what happens when your community lacks resources or it lacks the education out there once they leave the walls? Jails are in particular challenges there because people come and go very quickly. And we all know that lack of reentry, that lack of continuity of care is also a factor in recidivism. One of the things that NCCHC Foundation is focusing on is that educational aspect, reentry aspect, and just ensuring better health, introducing those strong evidence-based practices are occurring not only in the walls, but also when somebody leaves. And especially with your youth and your, we'll say juvenile reentry, but your youth reentry is a big part of that. You have somebody it's a good intercept point in the system to get a hold of somebody when they're young and try and prevent them from recidivating and coming back to the facility. One of the cool things the foundation does, Kim had mentioned the support for the scholarships, is we'll bring, I think we're bringing 15, is that right, Kim? Is it 15? Okay, so we're bringing, it's right here. So we're bringing 15 students that come, and they're basically early career professionals within correctional healthcare. They've recently gotten into the field. We bring them out so they can actually be our guest at the conference. We pay for them to come out, and they get to experience and network and do everything and kind of see what the field's really about. Because I think a lot of folks can really agree on correctional healthcare is a great secret when you look at the overall swath of the abilities that are, or the opportunities that are out there. A lot of people really enjoy this field coming into corrections in particular because of that teamwork, that esprit de corps, and the mission, right? The mission is we want to help people, whether you're on that law enforcement side, but especially medical. You come in to help people and get those people that really need the help that don't get it. This is the population you really want to focus on. And a lot of people really take to correctional healthcare. So we get them in early and kind of get them developed, get them excited, and get them to network with everybody. And it's a really cool event. You'll see them at the foundation reception if you do come out. We do introduce them and they'll talk a little bit. Some of them will talk about their stories. And it's really awesome to see that. So we'll go to the next one there, Kim, and I've got the information about the foundation. We have a website also for our online auction. There are a couple that'll be done at the event, as Kim had mentioned, but there is actually an ongoing online auction right now. The link is inside of this page, and you'll get that. We also accept the donations, and you can learn more about the foundation on our website. There's also a QR code to scan there. They will be at the exhibit hall, and Julie, our fundraising manager, will be on site to answer questions as well. All right, we'll go next slide, Kim, and we're going to go into NCCHC resources. So some of you may be familiar, we call NCCHC resources NRI. That's our consulting arm. So it's our consulting part of our organization. They're separate from accreditation. They're separate from the main body. It's a separate 503c, not-for-profit. They are the technical assistance and consulting arm of the organization. They use the same premises as far as the standards for their basis of going out. But what they do is they will come in and they're going to look at potentially you're having issues or you want somebody with a third-party eye to come in. Perhaps you're thinking about accreditation and you want to prepare for it. So we can come in and do a mock survey and come in ahead of time. One of the things I emphasize when I talk about resources is they're siloed from our accreditation team. It's a separate process. They don't share notes one way or the other because we want that to be objective, third-party type of deal for you when you're getting those consulting services. We don't want it to affect accreditation or vice versa. So basically, they operate in silos. Somebody that comes out as a consultant on that job will not be a surveyor on your survey later on if you're doing something like that, or you're re-accrediting and doing your survey. We'll put together a team of experts, and that can vary. We might have people from custody. We might have jail administrators, medical administrators. We definitely have clinicians, other educators come out. We deal with everything from basic training all the way up to coming in and doing death reviews. Something we do is that entire swath, and the accreditation preparation and just system measurement, system analysis are probably some of the biggest things we do, in addition to suicide prevention, as you can imagine. getting help with the suicide prevention program. Kind of ahead of myself, but the next slide will kind of cover some of those projects I've talked about. I won't go into a bullet point by bullet point, but another big one that's been kind of a newer one is our RFP development and contract monitoring. What happens is we'll come in and we actually help with that RFP development and the monitor contracts as well. Typically that goes toward more of the facility side than it does our medical providers, but the evaluation is a big demand where we come in and look at the health services. We identify potential loopholes with that third-party eye just coming in from the outside, and we're very successful offering those and helping our partners and our clients work through potential issues or identifying issues proactively to prevent issues down the road. The training I mentioned as well. So our next slide has our context there. They will be on, it is our conference, everybody's going to be there, but Fred Meyer and his team will be on site at NCCHC Resources at their booth. We're conveniently all located in the block, so if you're looking for multiple services, we'll all be there together in the exhibit hall, pretty much in the same row. Their contact information, some of their case studies, and their website is also listed on this slide. All right. So we go to the next slide here. We're going to kind of wrap everything up here, and I'll turn it back over to Kim here in a sec. But the one thing we've kind of talked about today, look, we all come from different areas, but we all have that common goal, right? And that's providing quality correctional health care, taking care of the folks in our custody, keeping our patients safe, keeping our staff safe. And we all come from that same background, that like-mindedness. And that's what our conference does, is kind of wrap this all together. This is just one of the tools that we offer as a service. It might be your first time here. It's probably going to be overwhelming. It's a big group, and it is a lot of information, a lot of great information. But, soak it up, take it in, and do that networking like Kim talked about. That networking is such an important part and such a great opportunity. And the one thing I'll say from going to conferences, if you don't ask the question, you don't have the discussion, I guarantee you'll be on the way home and go, man, I should have asked this, or I should have had that discussion. So take advantage of everybody being under that same roof in that same area for those few days. And I think you'll really enjoy what we put on. And I know we enjoy putting it on for you. We enjoy it's a lot of work, but we have a great time there with our folks. And I think you'll agree when you go out. Kim, I'll go ahead and turn it back over to you to close it out. Thank you. I appreciate it. We look forward to seeing everybody.
Great. As I said before, we will send out a link to the slides and to this recording as soon as we can post it. So this is the link where you should be able to find it. And we've got one last poll question for you. Let's see if we can bring that up, and hopefully we can actually make the poll show up this time.
Our report card here. Uh-oh.
Yeah. So if you can see the poll, if you got your money's worth from this free webinar, we're a little slanted on our question here.
You guys we have more emails last time, I think.
A much nicer group here.
Cool.
So cool. I don't know if you guys can see that response, but 82% thought very useful. So we thank you for that. And 18% said satisfactory. We'll take that grade as well. And we will just open it up for questions. You can shout them out from where you are or put them in the chat. I know Matisse has got some specialized CCHP questions that she's answering. And we can.
Yes, my fingers are sore from typing. I've typed a lot of responses directly. So some have gone to the group, some haven't. The biggest question that I'm seeing privately, as well as I believe posted to the group, is whether or not you can still apply and test. It's kind of a loaded question, so I need to be really careful in what I'm telling you there, okay? So please, everybody, listen. Number one, conference registration is separate from the CCHP application and registration process. So that's number one. Number two, can you still apply? Absolutely, you can still apply. Can you register on site? Perhaps. We account for a certain amount of room and a certain amount of exams, and that's why we have the application deadline and registration deadlines that we do. If your application is approved and we can accommodate you, then we would be able to register you on site. I cannot say right now definitively that it would be a yes. I will tell you we will accommodate you as best as we can, but we can only answer that question at exam check-in. That's 12:30 on Sunday outside of the exam room, which is Concord A. Now I'm going to throw something else out to you guys as a group because I wish I could buy a banner that says this. While you can still apply and might be able to register, I will let you know I've been with NCCHC for 19 years. Statistically, the folks that are applying and registering for the exam this late or on site don't do as well. I'm not saying anything about you personally. I'm just letting you know statistically, people that apply this late and register this late do not do as well as others. So come see us Sunday, 12:30. We will do the best we can for you, but we also want you to be successful. So, so that's an answer to that. In terms of when the next exam is, right now, I mean, we have many. Some are on our calendar. Some are closed exams that are not on our calendar. For right now, our next plan hosted exam is at the spring conference in Kentucky. However, number one, exams get added all the time. You just want to keep watching the CCHP calendar on our website. But also, we've contracted with Prometric. They have test centers nationwide. There's even the opportunity to take the exam at your home or office with a remote proctor. I will be happy to answer questions about this and really anything else under the sun regarding CCHP at the booth, at my session, but also over email. I threw out the email address, the cchp@ncchc.org. So if you'd like to chat before the conference, I'm happy to answer your questions, or otherwise, I will be happy to talk with you at the conference.
Cool. Glad you were here, Matisa. All kinds of CCHP questions.
Me too, and I love it.
Thank you, everybody.
That's a good sign.
It is
That's always good.
fantastic. We will let you all go. We appreciate your time today, and we'll stick around for a few minutes if anybody has anything else that they want to ask. But thank you, and have a great afternoon.
Safe travels, everybody. Look forward to seeing you at the conference.
Absolutely.
Thank you.
Bye.
Kim, do we want to put the QR code for the app back up real quick? There's a couple of app questions, it looks like.
Oh, sure. I can do that. Maybe.
I threw the link out again too to download the slides.
Great. All right. We'll
All right.
see you in Las Vegas, everybody. Thank you.
Travels all.
Bye.